The American College of Cardiology and the American Heart Association consider supervised exercise therapy as a level 1 recommendation for the treatment of PAD. I encourage everyone, no matter what your diagnosis, to be physically active around 150 minutes a week. So that's 30 minutes most days of the week. A supervised exercise regimen usually occurs in a medical fitness facility, a health center, or a community-based center. And in a supervised program, you're engaging in exercise for around 30 to 45 minutes, 3 days a week, and that is under the supervision of a personal trainer or health coach. That personal trainer or health coach will have received recommendations from your provider around where you have been experiencing pain in terms of how long you can walk before you actually have to rest, and then they will undertake an opportunity to devise a program with you to progressively increase the amount of time you can be active between rest periods, because that's the way you're going to get better with PAD. You need to push past the pain and continue exercising with intermittent rest periods. And then our goal in working with you from a supervised perspective is over time to increase the duration at which you're active and decrease the number of rest periods. The benefit of working with a personal trainer or a coach is that they can actually document and keep track of how well you're progressing through the program, and also motivate you during those times when you may be predisposed to stop because of the discomfort in your legs. In addition, during those 3 times a week sessions, your coach will talk to you about what you're eating, what you're drinking. If you need any type of coaching on tobacco cessation, they can work with you there. Your physician or part of their care team will provide you with recommendations on where you may go in your community to find a structured exercise program. They may be offered at the cardiac rehab facility that may be associated with where your cardiologist or your internist works. Many community programs like the YMCA also offer structured exercise programs for patients with PAD. Working through the pain when you have PAD is key to allowing your muscles to adapt to the amount of oxygen that's being delivered, because over time, your muscles become more efficient at using the oxygen that's being delivered. So one, by making the lifestyle changes, reducing smoking, managing your diabetes, eating a healthy diet, hopefully you're reducing some of the factors that are causing your arteries to narrow. But secondarily, by pushing your muscles past that point of pain, they're becoming more efficient at using the oxygen that they're receiving. So when we're working with someone with PAD, we encourage them to engage in a program with us for 12 to 24 weeks. 12 weeks is on the low side. We'd love to keep you engaged with us for about 6 months, but that's the time period that you need to be engaged in a supervised exercise program to see some of the benefits at reducing your claudication. So anyone who's exercising, first of all, we always ask them to get clearance from their physician. Anyone who undertakes an exercise program is at risk for chest pain, shortness of breath. You're also at risk for, if you have diabetes associated with your PAD, having changes in your blood sugar. And then again, if you're diabetic, I'd also make sure that we work with you to look at your feet and check your feet, because you may also experience neuropathy, which could predispose you to having sores or blisters associated with exercise on your foot, and those need to be managed and monitored. But our biggest concerns are, especially for someone who has not been active, if they experience any symptoms associated with potential coronary artery disease, that we have you evaluated by your physician. So one of the additional benefits of supervised exercise for patients with PAD is that it allows your body to develop new pathways to deliver blood flows to your muscles, so that pushing past that pain and actually encouraging your body to adapt to increasing exercise creates new pathways for blood to get to your muscles, and that will actually allow you to be more active over time. Your body's an amazing thing, and it's like building new roadways or new paths to get to the areas of your muscle that may not be receiving enough blood, but you can develop small, new arterial offsprouts from your existing arteries that will help deliver oxygen to the blood in your lower legs so that those symptoms that you're experiencing from claudication will be diminished over time.